Today we've got a nice little interesting one with Keep It Simple episode number 2.
Yes.
What are we covering today, George?
We are talking all things ankles and what are the most common things you see with ankles in clinic, or at least what I see most commonly in clinic.
I think what you see most common in clinic is what I see most common in clinic because
Simple things are common.
Indeed.
Common things are common.
So, number 1, we're going to go
Question.
with ankle strains, sprains, whatever you want to call it.
Yes.
We are for it.
It's like there's that meme, isn't there, where there's somebody shows you a picture of an ankle that's just been rolled,
Yeah.
and you always look at it and just go, "Ugh."
And you go, ooh,
Oh.
because we've all experienced it. I've rolled my ankle at least 3-4 times in my lifetime.
It's the most common. It's one of the most common sports injuries, occurring for 45% of all sports injuries anywhere in the body.
All sports injuries.
All sports injuries.
Yeah, I mean, that is huge.
That is a lot, like,
Yeah.
as you said. But some people suffer it minorly, some people suffer it majorly. Of course, I've actually suffered from all of these.
Spain without the S.
I am going to Spain this summer as well, so but more on that later. Anyway, so
Is it going to be an in-betweeners episode?
oh no, definitely not. No. I've outgrown those days.
Okay.
The in-betweeners are a special lot. But no, so yeah, ankle sprains are so common, more common in people who are very active, and very commonly linked to sports such as like football, running, rugby,
Yeah.
just anything, and tennis massively. I think Andy Murray is known for having so many ankle sprains, and for the last 10 years he's been wearing ankle supports through all of his games.
And I think it really comes down to how much within your sport you are moving within the transverse plane, which is side to side.
Yeah, hence why it's rolling the ankle. Now, when it comes to rolling the ankle, there is one roll that is most common, and that is your inversion sprain.
Indeed.
So basically, it's like when you roll over your ankle and your foot goes inwards and your ankle goes down, and that can affect minorly to majorly, and we usually class that in 3 different grades.
Yeah, indeed.
Do you know what grades those are?
So, grade 1 is when there is minor tearing. Really, that's not much of an issue.
Focused on one ligament mainly, which is your anterior talofibular ligament.
Yep. And then grade 2, we're looking at a partial strain / partial rupture. So you would find a little bit of bruising, a little bit of swelling within the area.
Anything between 5% to 95% of the ligament structure. So, but that's also taking into account your anterior talofibular ligament, which sits at the front of your ankle, but also your posterior talofibular
Or
ligament, and also your.
calcaneofibular ligament.
You beat me to.
Yeah.
So that's a grade 2.
Yep. Grade 3 is when you have multiple ligaments that all rupture. So that will most certainly include swelling, bruising, and usually takes a lot longer compared to grade 2 because
About 3 months to heal, but then rehab takes a lot longer than that.
Indeed.
But it can also hide fractures, and it can also strain another ligament called your syndesmosis ligament, which sits above the ankle itself.
Yeah, and that's just on top of what we call a sort of cuboid bone.
Yeah.
Indeed.
It is exactly that, Gab. So thank you very much. So grades of injuries are very common. So yeah, so as I said, like if you do a grade 1, which is very minor, a slight strain, anywhere between 0 to 5% of damage, you're not likely to suffer any bruising. You're not likely to suffer any swelling. You won't lose any balance. Quite quickly recover. Grade 2, yes, this is going to take longer to recover as there's quite a large tear, and you normally hear a pop or a click with this.
Yeah.
I remember mine when I did it at Sports Day in my 3rd year.
Oh my
You
God.
were there. It would have been your first year at
Yeah.
uni.
Yeah.
I was playing rugby, 10 o'clock in the morning. I took a step backwards. The ball's miles away. I'm not even playing at this point. Put my foot in a rabbit hole, and I just hear and fully ruptured my ATFL.
Wow.
And so then I joined the tent with your
And
youth
on
mates.
that day, we could just see George stumbling across the field, just going.
That was like my 4th injury of that year, so I deserved to have a drink at that point.
Yeah.
To forget the pain. And I also had an exam 2 weeks later.
Oh damn.
So here I am with like no ligament in my ankle, and I strapped it up so much with the support just to get me through the exam.
Oh my God.
I remember like doing it and hobbling as I was like having to bend down to like check my patient's ankle. I was like, oh my God.
Was that an OSPE?
I don't think we called ours an OSPE. What was it? It was a continuing patient assessment, CPA.
Oh, so yeah, so
Because it changed for you.
Yes, indeed. We had MCE or OSPE. MCE was mini clinical examination, where you go into clinic and it was a mini examination. They test you in accordance with how you treated a patient.
Yeah.
And OSPE was an observational specific practical examination, where
Right.
you were given specific tasks that you had to complete in a specific time, and they were all set out within categories. So you'd start off with orthopedics, neurological, cardiovascular, and then a bit of rehabilitation.
Okay.
So-
yeah, ours was slightly different to that, but I think that's also because I'm older than you and things
Yeah.
changed slightly. Because I know that students who were 2 years below us at uni, they started doing the same thing again, would be in the same year group as you. But yeah, ours was a CPA. But anyway, got through that absolutely fine.
And tangent over.
And tangent over, and then grade 3, yes, you're more likely to have torn multiple ligaments, lots and lots of swelling, complete loss of balance. Much like a grade 2, you'd have complete loss of balance. But yes, you could also suffer from a fracture, and there will be some form of bone bruising going on in the area as well. It takes a lot longer to heal. But because it's so common, just even a simple roll of your ankle, if you roll your ankle once, the reoccurrence rate of that ankle injury happening again increases by 50%. Yeah?
That is wild.
And
That
yeah,
is wild.
And I see people come to me who may be 50s, 60s, 70s, and they're like, yeah, I've rolled my ankle many times when I was younger. Have you done anything about it? How was your rehab? I always go, so how was your rehab for that?
Yeah.
Like, fish them into that answer, like, because a lot of them just go,
They've done
it
nothing.
wasn't great.
Yeah, and the thing is, what we have to try and really, in this Keep It Simple series, is give you the best information when it comes to rehabilitation.
Because it's so simple.
Number one, it is not your strengthening, it's not your mobilizing exercises, but number one is your proprioceptive exercises to reducing chance of reoccurrance.
Well,
now, why
interesting
is that?
you should say that, actually,
Go for it.
because it depends what grade tear we're talking about.
True.
And it depends on what damage has been done, how long they've been inactive on it.
Mhm.
Realistically, with an ankle, you want to be active on it again within a week of it happening. But if
Yeah.
we're talking about grade 2 or higher, if it's a grade 1, you can be active on it straight away. I would normally start with some form of concentric exercises, such as TheraBand exercises to build strength up around the ankle.
Mhm.
I would then move on to more lateral movements a week later
Mhm.
to start building up the lateral peroneal quite commonly, because that muscle can get pinched underneath those ligaments when the ankle rolls. And then once there's that kind of strength in the ankle, I'd start to move into maybe a wobble board and stuff like that. But through that process as well, I would get them to do like single leg stands, maybe a hand on the sink whilst brushing their teeth, slowly building up that balance through that way, because proprioception is key. But a lot of times when I see it further down the line, it's because people haven't honed the muscles or retrained or reactivated
So
correctly.
I think in an expansion to my point a little bit is I'd say proprioception in my case is a very simple exercise that I
Yes.
kind of give them, just away from strengthening, away from mobilization, is
Yeah.
actually just once they've done it, I'll strap it all up, I'll give it the relief that it needs,
Yeah.
and then I ask them, if you have a seat, what I want you to do is sit in front of a mirror and just look at the way your ankle moves
Yeah.
one to another. Try and compare the two sides. So what you're going to do is put it down,
Yeah.
bring it up, go in that slight inversion and
Yeah.
eversion. Granted that you're able to do those movements pain-free,
Yeah.
and making sure that you're always trying to not push it,
Yeah.
but slowly developing that movement.
And that's what rehab is. It's a process. It takes time. You've got to give it frequency, you've got to give it consistency, and you've got to give it your time. Yes, it's tedious. Yes, it can be boring, but it pays off in the long run. Takes pressure off your knees and your hips if your ankle's working correctly.
Yeah, and one of the biggest things that we kind of see within knee pain. So a lot of these people will sort of say, you know what, I sprained my ankle and then now my knee is very painful or my hip is very painful. I'd say close to 9 times out of 10, if someone comes into me with knee pain, the first thing I'm thinking of, okay, are we looking at this from a top down or a bottom up? Which means,
Or from
is the
bottom
ankle...
from the foot up, not the bottom up, because then you'd just be looking at the back. Gotcha. Oh, got you on a technicality there.
Wow.
Oh.
Oh, yeah.
Well.
Logically speaking,
It all comes from the back.
yeah. So are we looking at this from the point of view of the ankle being dysfunctional, which has then caused the knee to be dysfunctional, or the hip being dysfunctional, which then dropped down into the knee?
So I think what we're really saying here, Gabs, is if you've twisted your ankle in the past and you haven't done anything about it,
It can
go
be,
get it checked, go get it sorted, and rehab it, re-strengthen it.
because it can lead to then knee pain.
Exactly.
And then issues higher up into the hierarchy of joints.
Exactly. And also I think the statistic is it's more common in men. Oh no, it's not. That's something else. It's both equally common in men and women as well.
Okay.
Because it's that common.
Yeah. Yeah.
But other things that can predispose it is poor footwear as well, poor proprioceptive balance, poor muscle tone through the area as well. Again, previous injuries. If you're actually got a high arch in your foot, you're more prone to getting it as well.
Yeah.
But yeah, so those are just. So that is probably the most common one that I see. I love treating it because I find with it, when you treat your rolled ankle, work into the lumbrical, so the muscles between your toes, because they usually get pinched and inflamed when you roll it. Also work into the actual perineal, because once you release that, the results are insane.
So I'm going to throw this out there.
Throw it out there.
A very common one, a common group, mainly because if you are out there and you suffer from this pathology or illness, diabetes.
Diabetes.
A lot higher rates of inversion sprains.
Yes, and that's for a very specific reason, though, isn't it, Gabs?
Yes, indeed. It's a diabetic neuropathy.
That's it. And so a neuropathy again
Is damage to the nerves.
That's it.
Yeah.
So a lot of people who have diabetes or don't know they have diabetes, it affects their Schwann cells, so the protective layer of the nerve. Therefore, once this becomes damaged, the conduction of a nerve doesn't function as well and results in pins and needles, numbness, or even muscle weakness of the area the nerve's going to supply it. And most commonly, that can start in the feet.
Yeah, and just as a general bit of information, if you are worried about whether you do have it, the first part that you do feel any sort of neuropathy from diabetes actually starts in the thigh, medial part of your thigh.
Medial part of your thigh?
Yeah.
Oh.
It's pretty interesting, right?
Interesting.
Because interestingly enough, my dissertation
Was on that.
well, actually, you know what? I'm not going to bore you guys.
I was going to
on
say,
it.
if we ever do an episode on exercise-induced bronchoconstriction, I'm your guy. But yeah, let's not get into dissertations. It's the most depressive thing in the world. Unless you love studies.
It was a topic that I really loved, and then I ended up hating it by the end of it.
Oh, same. Well, actually, no, that's a complete lie. I hated it all the time. I learned to love it for a day.
Yeah.
When I chose it.
Yeah.
Anywho,
Moving on
and slightly upwards of the ankle, another very common thing we see is Achilles tendinopathies, tendinitis, or even ruptures.
Yeah.
So we all know what the Achilles tendon is for the great man Achilles himself,
Yes.
with his weakness there,
Yeah.
and his brother Bofa. But we won't say that.
No.
We won't go into that. But Achilles.
Bad George.
No, but sounds like I said Boba from like Boba Fett, but we know it's not that. We know it's a different joke. Anyway, we know the Achilles tendinopathy. So the Achilles tendon attaches your soleus and your gastroc, so two strong muscles of your calf, and it all comes down to attach onto the back of your heel of your foot, otherwise known as your calcaneus. It is an incredibly strong muscle and doesn't get as much praise as it should do, and people are always surprised when it gets injured, because when we're doing activity, it takes 10 times your weight.
Wow.
Because if you're jumping and you're landing through it, it's having to break that landing, slow you down,
So that your
and
knee
again,
doesn't just
collapse
pop with every single time.
And also, you don't fracture your foot when you land from it.
Yeah.
And people go, it's actually your calf is your strongest muscle in your body.
Interesting.
And and a lot of people wonder, but it's not the biggest.
Yeah.
It's the strongest because of the muscle configuration of the fibers.
Interesting. Yeah, makes sense because it's multi-pannate.
Yes.
In
So
how it sort of.
it almost comes in like the look of an arrowhead in your soleus, and then obviously you've got two muscles, your gastrocs, and people go like, oh, don't go too heavy on your calves, and it's like, well, when you go to the gym and you train calves, you're lifting your body weight plus extra weight. So for me, if I weigh 88 kilograms, and then I'm adding another something like, let's say 120
Yeah. I mean, last
do-
time we trained.
No, so if we were doing that 80
Yeah.
kilograms, so therefore you've got a total of 168 kilograms going through your calves, and you're still able to squeeze out about 16 repetitions of that.
That's pretty good.
But that's it. So like, when you know you've got a real issue in your Achilles, or you've got muscle weakness in your Achilles, if you struggle to get past 10
Yeah.
heel raises up against the wall, singularly,
Interesting. So that's a really good way for people to assess what's going on.
assess their strength. Yeah.
Indeed. So keeping it simple, ladies and gentlemen,
Keeping
we've
it
given you the
simple.
way to assess what strain of your ankle you have gone through,
Or weakness if there's a nerve irritation.
and how can you assess your issues with your gastrocs, calves. Next one.
Well, let's keep on it a little bit before we hop on to the next one, because we need to go through who gets it.
Oh, okay.
Yeah, we
Okay.
need to go a little bit deeper.
Okay. Sorry.
We're keeping it simple, but
we
we're
still
going
want to be comprehensive.
exactly, because I want to tell the people what to do if they think they've got it, or what
Interesting.
levels. Because again, people go, "Oh, I've injured my Achilles tendon," but to what point?
Yeah.
Because it commonly happens in runners.
Mm-hmm.
And also, what it is basically a tendon itself. We discussed in previous podcasts, tendons have very poor blood supply,
Mm-hmm.
very poor. And actually, within about 2 to 7 centimeters, where the Achilles tendon attaches into the bone, there's actually the least blood supply there is possible. And sadly, that is most commonly where these injuries happen. So if you don't have a good blood supply, healing takes longer. Now, with doing loads of sports, loads of weight bearing, if you go to the gym and pump out loads of weights, you normally wake up the next day and like, oh, I'm really hurting. Well, that's because you cause micro trauma. If you go running all the time, never give yourself breaks, never stretch it out, and you cause that damage, you can cause pulling on the tendon because it's taking all that weight, and that's causing micro trauma. Overloading, overtraining, people who run every single day are the most common people to suffer from this, because of that build up of micro trauma. That can lead to grade 1 tears, as we discussed with the ligaments in the ankle
The
previously.
same thing applies with muscles.
And it goes to grade 2 again, where you've
Yeah.
ruptured a large amount of it. And then you go to grade 3, where you get a full rupture, and you know this has happened because you can see the gap in the back of your heel,
But
and you can't point your foot.
exactly. But also, when it happens, it's literally like a gunshot.
Oh,
If you look at, so ladies and gentlemen,
Oh.
if you do have a pretty strong heart or pretty strong stomach, just search it up on YouTube, gastroc or calf rupture. It literally is a gunshot, and it just goes bang.
It's like taking an elastic band to its end point and it pops
Yeah.
open.
Yeah.
It's my biggest nightmare actually, because I know somebody who just got it from walking up the stairs.
Wow.
Broke out. They were training for triathlons and were a crazy
Micro trauma, which
athlete.
then built up to just.
Exactly, and she just explosively ran upstairs and it
Yeah.
popped. And what do you do for that? You need surgery.
Yeah.
And that keeps you out for months, even a year to recover from it fully.
And the thing is, as soon as you've had that surgery, that's it.
Yeah.
Your calf will never, for your life, ever be the same.
Yeah, exactly. I think David Beckham's really famous for having one when he played for AC Milan.
Mm.
Came on for 5 minutes and then like bam, it happened, and he was.
Yeah.
That's pretty much where his career stopped. He did come back from it, but again, you got to remember how much money, how much input is going into getting his ankle back stronger.
And he came back pretty damn quick.
Yeah.
Like talking just a couple of months,
Yeah,
maybe even less.
yeah.
And he
You
was
know,
back
you
on.
reattach it, you rehab it, you get all this amazing treatment. But if you go here through the NHS, things are maybe going to be a little bit slower to get in for the operation first of all, because they're massively backed up due to COVID.
Yeah, and was that the same as Michael Owens?
Michael Owen, I can't even go into how many Michael Owen had. Michael Owen had multiple when he had
Yeah.
it. I think at one point he had like 9 to 16 pins in his ankle at one point.
God.
So yeah, so you don't want that to happen. So how do you avoid this happening? Don't wear bad shoes to run in. Don't run on don't constantly run on different surfaces,
Yeah.
because your foot's not necessarily trained for that. Give yourself a break. Remember to stretch, strengthen the muscle. It is more common in males than females.
Yep. You could also take a slightly more extensive measure if you want to try and get it better. So cryotherapy is a very good
Yeah.
way to try and get things to get better. A very good solution. If you don't have the luxury of a cryotherapy, get a big bathtub, fill up with 3-degree water, and just put your legs into it.
And
Really
also-
good for recovery.
And also with all of these, see an osteopath. We know what we're doing. We can help.
And the thing is, we can tell you what is going on.
Yeah.
And that's the beauty of it. It's you're not just wading through murky waters and just hoping that there's not a shark underneath that murky water.
And people go, but if I've fully torn it, there's no way you're going to be able to work on it. Post-op or rehab, we can.
Yeah.
Yeah.
And there's
Well,
a
not
lot
post-op,
that we can
rehab.
do.
We help with rehab, yeah. I
And
used to
there's a
do
lot
it on
that
the
we can
NHS.
Mm-hmm.
So yeah, and again with it, it's similar as to the ankle. You got to build it up slowly, build up the proprioception, build up the strength naturally through it as well. But because it's a tendon and it's got even less blood supply than the other ankle injuries, when we talked about the sprains and strains, it will take a lot longer to heal.
And even once it has healed, you still need to make sure that you're not allowing it to reoccur, because it can reoccur.
And the fun thing, yeah, exactly. The fun thing I had a little bit with it is that when you get told it snaps, if you have the person lay on their front, ankle hanging off the edge of the couch, and you squeeze their calf, what your foot should do is slightly lift up. Yeah? So as if you're pointing your toes. When somebody's fully snapped it, you get no movement, and it's scary.
Yeah.
And I had a patient come in once after rehab. He had a not full tear, but he had torn about 95% of it. And I was able to put my thumb in the gap.
Wild.
That's how big the gap was. And it was hanging on.
Wow.
Now, a lot of you will go like, well, if you did some work on the calf, isn't there a chance that you're going to push those last 5% over the limit? Not at all.
Yeah.
Do you know how much strength you need to tear a ligament or a tendon? Like when I was taught how to test ligaments at uni, in the knee especially, you'd always yank, but quite gently yank the knee. I saw an orthopedic surgeon testing a knee that was
yank it,
holding on by 5% of the fibres, and he's like yank it. And I'm like, oh my gosh, you're going to rip it off, you're brutal. And he was like, that's when he taught me, like, do you know how much power you need to do that damage? This is how you actually test it correctly and get a good result. And it went, opened my eyes.
Mind blown.
And I remember going back to clinic and everyone was like, and I told my boss, and he was like, oh yeah, I remember seeing that when I was your age and stuff like that. And he was like, but do everybody know this? And we were like, right, I'm going to do a CPD on it straight away. This is how you test the ankle.
Well, it's quite interesting because I was taught the same exact thing in an interview. So,
nice.
Yeah.
Test my knee.
Yeah, so I was doing a test, and then I kind of did it, and he went, the guy who was going to hire me, he was an orthopedic surgeon, Dr. Kuntz, and...
Risky name.
Yeah, really sweet guy. And he said, the way I'm going to show you, and this is the way you test out the knee. He literally grabbed the model's knee and went bang, bang, and I was like, okay, I've been taught very differently.
Really?
We're taught gently,
Yeah,
and he just
like...
literally, you see that gap? It was like, okay, wow, yeah.
I've seen a full ACL tear as well, and like when you know it's a full rupture of a ligament or something, you
know, and just send them off. Send them off.
Well, that's what I was rehabbing, because a lot of ACL tears nowadays don't get surgically reattached. You just build up the strength in your quads, your hamstrings to support you.
And that's enough.
It was still mental. I was there testing it. Like, look at that! Like in my head, I'm there obviously professionally going, wow, that is gone. But in my head, I'm like, wow, look at that! It's not moving. It's not moving.
Well, I mean, I had a very interesting one because one of my patients, who was one of those that just did not get it repaired, he said, oh, watch this. And he just showed me the way he just pulled his leg and it just go up and down. It was no problem. And I went, oh, it's not meant to do that. What's going on? And he was like, oh, I ruptured it a couple of years ago and they said it's fine. Just strengthen up the knee and you will have no problem.
I have a mate, he tore his at the ESO Sports Day tug of war, and he has no ACLs on either of his knees, and he walks around fine.
Wild.
Because his legs are huge, they're like tree trunks, so the muscle strength there is insane. But a living legend, this man. Anyways, the last one, PF, also known as
fasciitis.
Wow, I think one day we're going to just break out into song on here and torture our listeners with terrible music.
Say a little prayer for. No, no.
Don't.
No.
Copyright. We ain't. Not that. Not that we're going to get copyright at this point, but future.
Indeed. So, what
yes.
are the common factors that can cause plantar fasciitis? So, give us.
What is the plantar fascia, Gabs?
So, the plantar fascia. Let's begin with fascia. Fascia is an envelopment or a veil that covers all of your muscle and essentially all of your body, including organs, bones, and everything itself. Plantar means the sole or the base.
The bottom.
Indeed. So plantar,
Of your
base, fascia, envelopment, foot.
And what is another muscle commonly linked with plantar fascia?
The calf. Well, soleus.
Yeah, because they have the similar attachment point, but also flexor hallucis brevis, which is a muscle that attaches to your big toe, in again to the same point. So you've got three muscles attaching to the same insertion point of these.
It's the triad of plantar fascia. Lovely. Anyways, what is itis?
Yeah.
That's the third part. There's the plantar fascia and then there's the itis. Itis is inflammation. So what's happened there is you have done some sort of activity which has then irritated the muscle or the fascia and that has created inflammation. Inflammation can be identified with certain characteristics including calor, dolor or rubor, which is redness, pain, or heat.
I thought, like, have you just gone full Italian on me right now?
No, Latin.
Yeah. Hey, I don't speak one language. Give me a break.
At some point, I was able to speak 6.
What?
Yeah. Did you not know?
No.
Yeah. So
That's mental.
Yeah.
Mentally cool.
Yeah. So it
And
was
mentally smart.
Italian, English, Cantonese, Mandarin. Well, I'm on 4. Wait, is that 4 or 5?
American, Australian.
Neapolitan. Anyway.
Business. So basically, yes, and it again is classically due to micro trauma. It is most commonly seen in people who are on their feet all day or have very active jobs on their feet, running, walking, running, jumping. So
Running
security
is such
guards,
a
police
common one.
officers.
Yeah, running is such a common one. That's the main point. Is number one, you're constantly smacking that plantar fascia onto the floor. If you wear rubbish shoes, it's going to be even worse because the amount of pressure going onto the sole of your foot is increased massively. Remember, you're already getting around 10 times your body weight onto that foot.
Yeah.
If you wear shoes that are completely flat with no support or anything else, done. You're done for.
And if you got the classic flat-footed, you're at more risk of injuring it itself. And it's actually the part where it gets injured most is what's called the heel-off phase. And then followed by the toe-off phase. So that's as you stride through your steps, so as you're stepping off with the foot. That's because that's when it's put under most pressure and torsion. And as you toe off, you're actually engaging that muscle over a stretched area.
And it's quite funny because despite having that area where you're going to get the most of the occurrence, the pain is usually at the bottom of the arch.
Yeah.
So it meets in the middle, which is such an interesting thing.
And what I find with a lot of people with plantar fascia, if you put your thumb in there and you roll your thumb over it, it feels like you're popping bubble wrap.
Yeah.
Bubble wrap. Yeah.
It's like, if you love bubble wrap, just find someone with plantar fascia and just grind it.
Get in there. Get in there. Break it up.
They will hate you, but they will love you around 2-3 days later when it feels so much better.
Because that's the one thing you've got to do. You've got to get in there, break it down, increase blood supply, heal it, stretch it.
My partner, who does a lot of running, they essentially call me and they'll say, you know, we're on the sofa. And
call you on the sofa.
Well, we're on the sofa.
You're sat next to them, and then
We're
you
on the
just pick
sofa.
up, hey Gabs, can you have a look at this? And then out of nowhere, it just lands on your lap. You're like, oh yeah, there it is.
And just goes, can you do what you know, my foot needs a bit of help. And he's there just going absolutely crazy. Oh my God.
It's agony.
Swearing at me, you know, saying everything under the planet. But afterwards he goes, it feels better, thank you.
Have you ever had plantar fasciitis?
I have.
Yes.
In fact, I still have very low grade. I constantly have very low grade.
I was literally about to say, I think in our job we are so predisposed to it because we're on our feet all day. And no matter how much I wear my Docky Martens, doesn't save my feet from
No.
PF.
I wear the softest possible shoes. I don't think people ever see me without sort of Nike Pegasus or any sort of.
Hey Nike, if you want to sponsor us. Back to the podcast.
I love their shoes. Very supportive.
If you were watching on YouTube, we're literally just pointing to the camera every time we say that because we just want Nike to sponsor us.
Yeah.
Or anybody else.
Help.
Help. Even Lidl, who sell their own shoes, sponsor us.
We got you.
TK Maxx, sponsor. Anyway, yeah.
But I really love their shoes because I find that if I was to wear anything other than that, it just flares up. It just flares up, and I need people to just do it for me, or I just, treat it myself. Get a bit of oil and then work into it.
So after a long day on my feet, what I like to do is go home, get a tennis ball or cricket ball, place it on the floor, roll my foot backwards and forwards on it for a few minutes because it just breaks down those things and I feel so much better afterwards.
Or another one which a lot of you will probably have lying around, a can of beans.
Can it be? Cold bottle of water, throw in freeze a bottle of water, get that out, roll it.
And the thing is, if you do a cold bottle of water, what it
Bottle of
also
water.
does
Yeah.
is a little bit of cryotherapy.
Oh, like a
Double
bit of
action,
ice.
baby.
Why do we put ice on it?
Why? Because what it does is it starts to shrink or vasoconstrict the blood vessels. By doing so, when you release it and it's able to open up, it has this huge surge of blood that rushes around and pushes inflammation away from it.
Love that.
On top of that, it also have a analgesic effect, which is
Painkilling.
painkilling.
Gotcha.
Painkilling in its most natural form.
Ooh.
Yeah, baby.
Yeah, baby.
Yeah, man.
Yeah, man. So yeah, again, who is? I guess we kind of discussed who's likely to get it and a bit of what you can do to prevent it as well. I think it's the main thing. I keep getting my nose on it.
Yeah.
But yeah, nothing beats a good stretch through it as well. And that's the best way to calm it down. Also making sure you stretch out your Achilles because as we said, it's more than sometimes one muscle playing into the area. So it's good to release off all of these things. Now, what do all of these things have in common? They all happen through weight bearing. And when we weight bearing, usually when we're walking or moving, we're just constantly looking forward. You never look down at your feet. And as you discussed in, I think, our first ever episode,
Frankfurter Horizon, baby.
where as we get older, our visual horizon lowers because we're busy looking further down at the floor to see where we're stepping, to not trip up any curves or any
And getting an inversion sprain.
wood stumps. Yeah, exactly, because we no longer trust our proprioception in our ankle because none of us really spend time training it. So to try and help yourself prevent all of these things from happening, goes back to the three basic facts: balance, cardio, strength.
There you go. Keep it simple, baby.
Keep it simple. Any part of your body, keep it strong, keep it toned, keep your cardiovascular energy going, but most importantly, work on your proprioception. And some of you may be listening to this for the first time still go, what is proprioception?
Proprioception is how you perceive or your ability to have an awareness behind where your joint is in space, which is very different to joint proprioception.
Yeah.
It's more of a, how can I word it? I'm trying to word it properly.
What do you mean?
One of them is innate, one of them is trained.
Okay.
And
So
that's the difference.
what we're looking for with this kind of proprioceptive feedback is knowing where our joint is in our given space without having to focus on it, because we get feedback from our ligaments to tell us where they're under torsion. That means it's telling us where the joint's starting to move, where forces are being distributed, so we can balance ourselves without having to focus on that. It's our body also having seen the path in front of you, knowing, well, that's a bit high, that's a bit lower, and being able to judge in which way your ankle needs to land on that. And that's why people also get caught out and injure themselves, because sometimes if they haven't seen the curve or haven't judged it correctly, they go down, their foot's not prepared for it, they roll it because not the correct muscles have been activated to support the joint in that application.
That was a mouthful.
So proprioception, so for context, if you've strained let's say your anterior tibiofibular ligament in your ankle, so the ligament on the outside of your ankle that's most commonly strained with an ankle strain, it has become damaged, therefore the body's going, right, that's damaged, we need to protect that, we're not going to use it. So therefore it loses its proprioceptive ability, its ability to tell the brain where it is in a given certain space and where the tension is being applied to it in certain areas. And that's why you have loss of balance. So it's up to us to start to train that, reactivate it, create that neurological pathway to reactivate again for the brain to go, yes, I can feel that you're there, I can feel you're pulling that way, that means we need to balance this way. And that's why over time your balance will quickly
and I think that brings it back to where I kind of said about the first exercise, which is seeing where your foot moves and the way it moves, because that integrates your vision to the movement, which then retrains into proprioception.
And brilliant place to do that, yoga.
Yeah, it's fantastic. And a very common thing that comes with that, with lack of proprioception, is foot drop. With a sort of sliding, so you flick off of things with your foot. So for example, you're walking and you kind of feel as though your foot is dragging on the floor.
Yes. Yeah.
That is a very common one. So if you are getting that, you've probably got a lack of proprioception with your ankle.
And let's train that. You can train that, unless it's due to a sound zone.
Lightweight,
baby.
Yeah. Anywho,
those are the three most common things in the ankle. I like to think we kept it pretty simple. I like to think that we went into a bit of knowledgeable depth for you guys to understand what it is. And with all of this, rehab is important for all of these, and also preventative care. So doing stretches, doing your strengthening, taking time to rest off these muscles. But also, if you are worried about this, contact your osteopath, contact your physio, chiropractor, any of your medical healthcare professionals,
yeah.
practitioners.
Because motion is lotion.
Because motion is the lotion of life.
Indeed.
Anyway.
With that, we're going to leave it for today.
Yeah, we are.
That was episode 2 of Keep It Simple. Now, have a great day, and we'll see you guys next week.
Ciao for now.
Ciao for now.